Welcome back, everyone. Wow, we actually made it. Welcome to the grand series finale of our Dental Coding Masterclass. It has been an absolutely incredible journey getting here. You know, whether you're a medical coder transitioning into the dental space, a seasoned biller, or a revenue cycle professional, you have put in some serious hard work to understand the real intricacies of dental billing. Okay, let's dive right into this final capstone explainer. Today, we're bringing everything together to solidify that crucial bridge between the physical reality of a patient's mouth and the highly structured administrative world of the CDT coding framework. You've definitely earned this, so let's get to it. Here is a quick look at our agenda for today. We'll cover 1. Anatomy of a tooth, 2. Tooth numbering systems, 3. The CDT coding framework, 4. Applying diagnostic imaging codes, and wrap up with 5. Preventive care coding. Kicking things off with Section 1, Anatomy of a Tooth, the physical reality. To accurately code dental procedures, we really have to anchor our understanding physically inside the mouth first. It's like a giant puzzle. Notice the very clear division between the visible crown, the part of the tooth that sits above the gum line, and the root, which is embedded deep down into the jawbone. When a dentist is performing a restoration, a root canal, or an extraction, the physical depth and the specific tissues they interact with literally dictate the exact code you're going to use. Let's rapidly define these clinical layers so they really stick in your memory for when you're auditing an operative report. First, you have the enamel. That's the hard outer layer of the crown, and actually it's the hardest substance in the human body, designed to protect against decay. Right beneath that is the dentin. It's a bit softer, carries tiny nerve signals, and basically makes up the bulk of the tooth. Deep inside is the pulp, which contains the nerves and blood vessels that nourish the whole tooth. Down below the gums, the root is covered by a thin layer called cementum, which attaches it to the jaw. But here's the crucial point, the periodontal ligament. I really want you to remember this as the vital shock absorber. It keeps the tooth stable in its socket when you chew. Honestly, understanding these specific terms makes reading a complex dental chart infinitely easier. Moving right along to Section 2, Tooth Numbering Systems, Navigating the Chart. So, when we're translating physical anatomy to a patient's chart, we use universally recognized numbering systems. For primary or pediatric teeth, we utilize ranges like 55 down to 51 and 61 to 65. Then, for permanent adult teeth, we use numbers like 18 down to 11 and 21 to 28. This side-by-side layout mimics exactly how a medical coder views a real-world dental chart. You must immediately recognize whether you're looking at a pediatric chart or an adult chart just by glancing at these numbers. Think of it as the geographical coordinates for every single code you'll enter. Section 3, the CDT coding framework, the macro system. Okay, so every single CDT code entry is built on a very specific foundational logic. Step 1 is the procedure code itself. This is always a 5-character alphanumeric code, and it absolutely universally begins with the letter D. That D immediately signals to any payer or auditor, hey, we are dealing with a dental procedure. Step 2 is the category of service, which groups similar procedures together. And Step 3 involves subcategories. These just further subdivide the services to help you navigate through what is, let's face it, a massive code set. Let's chunk the first half of the 12 CDT categories into logical buckets so you weren't completely overwhelmed. D1000 to D1999 covers preventive care. That's your cleanings, fluorides, and sealants. Moving down, D2000 to D2999 handles restorative work, like fillings and crowns. D3000 to D3999 is endodontics. That is where your root canals live. D4000 to D4999 covers periodontics, which is the surgical and non-surgical treatments of the gums and bone. Finally, for this half, D5000 to D5899 is prosthodontics, specifically removable items like partials and dentures. See how logical that flow is? You go from basic prevention, deep into the tooth root, down into the gums, and then replacing missing teeth. Moving into the second half of our framework, D5900 to D5999 covers maxillofacial prosthetics. D6000 to D6199 is for implant services. D6200 to D6999 moves into fixed prosthodontics, like cemented bridges. Now pay super close attention to D7000 to D7999. This is oral and maxillofacial surgery, a highly complex area of the coding ecosystem that covers extractions, biopsies, and fracture treatments. Next up is orthodontics in the D8000s, and finally, D9000 to D9999 covers adjunctive general services, capturing all those miscellaneous items like anesthesia and professional visits. Memorizing these broad buckets, that is going to be your superpower for rapid chart auditing.
Section 4. Applying diagnostic imaging codes, the rule of context. Let's look at a really common code, D0272, which is defined as bite wing 2 films. These are X-rays taken primarily to detect decay. Now, depending on the clinical need, this has sister codes in the exact same subcategory. If the dentist only takes a single film, well, you'd use D0270. If they take 4 films, you escalate that right up to D0274.
But here is where we absolutely must apply the rule of context. To properly bill a bite wing, the clinical documentation has to reflect a clear view of the interproximal area of the tooth. That's the space between the teeth, right? Because the primary purpose of this X-ray is to detect decay hiding in those spaces. Furthermore, the billing rules state that this code may be billed separately, or it can be billed in addition to other specific radiographic codes, like D0220 or D0230. As a coder, you aren't just blindly matching numbers. You are validating that the clinical narrative justifies the code combinations being submitted on the claim. And finally, Section 5, Preventative Care Coding, Real-World Application. The specific code we utilize here is D1330 Oral Hygiene Instructions. Now, let me be clear. This isn't just handing a patient a pamphlet on their way out the door. No way. This code is utilized specifically when a dental professional provides dedicated, individualized, one-on-one oral hygiene education directly to a patient. So, the absolutely crucial point is what must be documented to support this code. The provider's note needs to clearly indicate that they offered guidance on proper brushing and flossing techniques, maybe dietary recommendations, or even the use of adjunctive products like interdental brushes. And to ensure a perfectly clean claim, you need to know the ecosystem this code lives in. D1330 may be billed to the patient's dental carrier alongside several other foundational codes, such as D1110 and D1120 for prophylaxis, or diagnostic codes like D210, D0150, and D0160. Knowing these valid combinations, that's what prevents denials and keeps the revenue cycle flowing smoothly. And with that, we have reached the end of our curriculum. A massive, massive congratulations to every single one of you on completing this Foundation of Dental Coding and CDT Mastery course. You've successfully navigated the anatomy, mastered the numbering systems, conquered the vast CDT framework, and learned exactly how to apply context to your audits. You are now fully equipped with the precise, structured knowledge required to truly excel in the revenue cycle management space. You put in the time, and the expertise you've gained here will make a tangible, immediate difference in your daily practice. I really hope this explainer has illuminated the structural beauty behind dental coding. But here is a final provocative thought to take with you. As dental and medical billing continue to converge, and they are converging fast, will you be the coder who merely matches numbers, or the one who truly translates clinical reality into accurate revenue? Keep pushing your expertise, never ever stop verifying the documentation, and always remember to decode healthcare with Harshell. Thank you so much for joining me on this masterclass journey.